getting guidelines for those people. Identified a need for on-call services for our department and setting up schedules for that, and we were provided with phones to accommodate this. We did all the signage and posters and, let's see.
And the list goes on and on and on, Lynn.
But prior to all of that, our big important step was looking at where our hand sanitizers needed to be placed in the areas and getting all that installed and up and going before the pandemic actually hit.
Okay. So lots of work for infection control. Donna, what challenges did you face once the pandemic actually hit?
Well, I guess everybody in our department faced a lot of challenges. But I guess from an infection control perspective, a lot of the challenges that we did face, we were able to work through them. And I must say, things seemed to fall into place relatively quickly. I guess initially we kind of felt that, the communication part of it, a lot of our frontline employees and our physicians and stuff didn't really feel they were getting the information that they needed because we use the internet as a big part of our communication. And a lot of our frontline staff, in particular the emergency department, our physicians and stuff, don't always use that as a good source of
Donna, we're losing you. Can you speak a little closer to the phone?
Sorry. And so we found as a department then we put out a binder, the Infection Control Resource Binder, and that certainly went a long ways in providing staff with the information. Are you hearing me a little bit better now?
Absolutely, Donna. Thank you.
Okay. The next challenge certainly was the data that we had to collect from an infection control perspective on a daily basis. And we used certainly all of our departments in acute care, long-term care, in our emergency departments. And I guess getting that information on influenza-like illness that was occurring in all of our facilities, because we needed that in order to, plan our day-to-day activities. So there certainly were a lot of challenges in getting that information, from all of our units and putting it together. But as time went on, it got a little bit easier.
Okay. So what will you take away from this?
What will I take away from this? I think as a team, certainly, I think we're going to be a lot better prepared to handle the next big challenge like this. Hopefully it won't be anything very soon, but certainly, I think we worked well together, all departments and stuff, and it did go a long way in helping us be able to cope with it.
Well, and I think what we saw was a lot of standardization throughout the entire region, and although it was done in a very short period of time, the pandemic allowed us to get it out and to get people educated in that way so that we can act in a consistent fashion throughout the organization. So thanks to Donna and Lynn. I just heard a lot of background noise and pages, so if you were on a phone that you can mute, it would be appreciated if you could mute that. Getting staff ready to face a major challenge is an enormous amount of work, and our HR staff faced many challenges in making sure that the staff were protected. You heard about PPE. We had fit testing and immunization of staff so that staff at the end of the day were not the ones that got sick. So we have Leanne Babcock, who works in long-term care in St. John's, who's an occupational health nurse with us. Leanne, are you there?
I am.
Can you talk to us about the staff immunization process?
Sure. Well, our occupational health team worked together in the months and weeks leading up to our launch date to get certain details ironed out and develop our schedules in an attempt to target as many staff as possible. To enable this, we had clinics set up at our different sites and different shift schedules in an attempt at convenience for healthcare workers requesting to be immunized. We also visited different units throughout the organization so the staff didn't necessarily have to come to us and face the lineups. Of course, our focus was to target different shift schedules from unit visits, including evenings and weekends. We also had the mass clinics that we held at Cordage Place, which are primarily for our healthcare workers. Leading up to the launch date, we also worked with our infection control team to deliver presentations to our healthcare workers surrounding H1N1 to help promote vaccination and, of course, the education surrounding H1N1. Our team also met weekly via teleconference to regroup, and then we made the changes to our delivery as necessary.
And I know that you vaccinated over 10,000 of staff inside of Eastern Health. What an amazing thing.
Mm-hmm.
What do you really take away from this experience? Because we've never had that number of people being vaccinated for regular flu season in any of our history.
Well, the involvement in pandemic preparedness and the mass vaccination program that accompanied this was a very valuable experience, as this was a first for a lot of us, of course, and it was a great learning experience. I feel that we can all bring something back from the challenges we experienced for anything that may arise in the future, such as another H1N1. My own personal knowledge I've gained during these events, of course, have certainly been very beneficial to my career, and it's something that I'll be able to take away with me for future use.
Thanks, Leanne.
Thank
Joy,
you.
I know you're here at Cordage Place, so this is Joy Thompson. She's what we would call Eastern Health Pandemic Planner, and has been involved in pandemic planning, like David, for a long time, and actually probably well over 2 years. And Joy and I spent time together in the EOC, and I often heard her say over the whole of the fall, the summer and into the fall, that she lived and breathed pandemic planning for the past 2 years. And she was instrumental in assisting many parts of the organization to develop their plans. We call them business continuity plans. Joy, how does it feel to see them coming together and coming to life and actually being utilized?
Well, Louise, so often we develop emergency plans that thankfully we never have to implement. But for me, being able to observe and support the activation of this pandemic plan was certainly very rewarding. It was the first time we used the instant command system, and it was great to see how well that worked. And then the business continuity plan. It was wonderful to know that, it wasn't all for naught. It was really important, how everyone came together and they knew what to do and what areas they had to be focusing on. I think overall it was wonderful to have lived through the experience, and we've learned a lot. We'll certainly improve on those plans. It was reassuring to see all the efforts that everybody put into that over the summer months was certainly appreciated, and I really enjoyed that whole process.
What will you actually take away from the experience? You lived it every single day.
Two things, really. I guess, first, the value of planning. This event certainly shattered a lot of assumptions, not to mention that most of the people never believed it was really going to happen. Although some of our various plans were in draft or they weren't exercised and those types of things that we probably would have liked to have had more time to put our heads around. I think overall it was very wonderful, beneficial process, and I think it really proves that planning is important. But secondly, the thing that I'll take away from this is even personally, I look at it as an absolutely amazing experience, seeing firsthand how all the support of the people, the family of Eastern Health had for each other in the face of this type of emergency. That whole experience was very, very powerful. People went above and beyond trying to help and to offer their assistance in areas they never worked in before or even knew existed in some situations. The ability to respond to this challenging event was, because really of this cooperation, the flexibility, and the overall amazing teamwork. And that will stay with me forever. I was certainly really proud to be part of this team.
Thanks, Joy. Coordinating resources and materials for a pandemic requires a massive effort, and Ron Johnson and his team in materials management really need to be commended for their incredible effort they put into this pandemic that we've been just through. There was never a question of that cannot happen. It was, when do you need it to happen? Terry Mercer is a storekeeper here in St. John's, and is the person, if you happen to look at our pandemic supply posters, you'll see Terry in those posters that were put around the region in maybe the early part of the summer. So Terry, are you there? Terry? Okay, we'll come back to Terry because we wanted Terry to talk to us about the warehouse that we have here in St. John. So we'll try to link back with Terry. And if Terry is not there, maybe Ron or somebody might actually be online. So we'll come back there. Elizabeth, are you there in Buren?
Yes, I am.
Elizabeth was the logistics person. That's a new name. Nobody knew what logistics was before we started this. She was the person on the ground in the Buren Peninsula. Elizabeth, can you tell us what you do in your day-to-day life in our Eastern Health? Not what you did during pandemic. What's your normal job?
Well, I'm the manager of material support for Peninsula's region. I manage purchasing, inventory control, shipping and receiving for the Burin Peninsula, Clarenville areas, and